And we have a really, really interesting person with us today on the podcast. His name is Dr. Aheed. Hi, Aheed. Dr. Aheed.
Hi, everyone. What's up?
Should I call you doctor or should I call you Aheed? What should I call you, man? What do you like?
Aheed is fine. Aheed is fine for now.
Aheed is fine. So we have Aheed, Dr. Aheed on the podcast, and he is a frontline worker, a doctor who is working in Max Patpatganj, as you mentioned. And that is the hospital that had the breakout. You were like the massive breakout within the hospital. You were mentioning about that, dude. Like that was really quite moving. Can you talk more about that? Like what happened in the hospital?
So honestly, we don't really know what or how they happened. I think there was, as far as because I also got my information from the news which broke out. And we were told for a long time that there have been some cases of staff getting positive and they are getting under quarantine. But we didn't know the exact number until the news was out. And what they had done was, I think there was a dialysis patient which had come a month ago. So, the thing is that with coronavirus and its doubling ratio, if you have one patient and he is left unchecked, and then that patient can infect in 30 days around 300 to 400 people. That is the number.
300 to 400 people.
If social distancing doesn't work, and if the people still goes on with their life, a single infected person can infect around. This is like a proper number which has been studied. Around 300 to 400 people it can infect in 30 days. That's the minimum number. If he goes to a gathering, then maybe more. So I think that would happen in Max. And the thing was that there was one dialysis patient who had later on come positive. He didn't know that he was positive. He was asymptomatic. And he came out to be positive. And then suddenly the Euro doctors and the Euro staff, then the same staff is circulated. And the same staff went into OT and wahan se got out into. And then all these sisters, they live together in hostels.
Right.
So wahan se bhi काफी उन लोगों को हो गया.
Dude, that must have been so scary, like knowing that
it was scary at that point of time, because I remember at that point of time I was only using a N95 mask, and suddenly one of my colleagues told me that you should not be just like that. You should be wearing like so you even PPE or personal protective equipments. They are of 3 levels.
Okay.
The first one is you wear a gown or a mask. The second one is if you wear that hazmat suit, and the third one is you wear airtight hazmat suits. So I happen to hazmat, SHAZMAT, that entire hazmat suit.
Oh, right, like the whole heavy duty stuff, like.
Yeah. Wow. So uske bhi 3 levels hote hain. So at least I thought that I should wear at least level 1. Because I happen to go into emergency a lot. I see children in the emergency, and some of them don't know their status, and some of them have no idea what's going on. So we need to be protected. Wow. So yes, it was scary at that point of time. Yes, no doubt about it.
Dude, is this true that if somebody has coronavirus, then there's a possibility that they don't show any symptoms, and they just like go out and about and just get the virus? It can go up to 300.
That is why all these. Yeah, that's true. So that's why all these. Yes, it is. So the thing is that it's coronaviruses is a family of viruses which has around 6 to, although it has a lot of thousands and thousands of viruses, but there are only 6 known human viruses, and usme se the last 2 were the SARS virus and the Middle Eastern Respiratory Syndrome virus, which was in 2003. In 2003, it was SARS, and in 2012, it was MERS. And these two viruses are very lethal viruses, but their level of transmission is low. They don't spread that easily. So what I tell you that the number for coronavirus is 340 or 400 in 30 days. For SARS, it's just 12, 16. It doesn't even cross the 3-digit number.
Right.
So this virus has shown.
Is that the reason people don't remember about SARS and MERS, and people now are?
Absolutely. We as a society, especially the Western society and the South Asian society, has not encountered a respiratory virus, and they don't know what to do. You remember there was this one time in 2012 when everybody who was in China was wearing a mask, and we were like, हाँ ठीक है, ये लोग तो हमेशा कुछ ज़्यादा ही अपने precaution लेते हैं. India भी आते हैं तो mask पहनते हैं. But they are equipped with how to prevent a respiratory virus, and I think that's why all the Asian countries have responded well to a respiratory pathogen, and we on the other hand are still struggling.
Damn, even though we're Asian, technically.
Yeah, I would say we are South Asian.
Right. I know what you're saying. Like, it's actually like I don't remember anything like this before, actually, to be honest. Like, this has been the news has spread so much, and like it's actually a pandemic. And as an adult, this is the first time that I've realized that, oh my God, okay, something like this can happen where the entire economy shuts down and you have to be at home, quarantine, and that's the only way you can save lives. Yeah,
this hasn't happened in the last 100 years, I would say. It happened in 1918 last.
1918. Yeah, that was
the
last Spanish flu, if I'm not wrong.
That was Spanish flu, yeah. Something like this. So even though there were pandemics in between, there was the influenza pandemic, I think in the 1960s or 70s. But उसने million mark और cross नहीं किया था. सिर्फ Spanish flu crossed the fifth. Well, Spanish flu killed around 50 million people.
Damn.
And
50
this virus, yeah, and this virus hasn't yet crossed. I think this virus has crossed the 1 million death mark.
I think it has, yes. Overall.
Yeah, so it is a little big deal than we thought it would be.
Damn. Yeah, Aheed, मेरे को एक बात बताओ यार. I mean, you have been at the front line working in the hospital. You see patients on a daily basis. You mentioned that you work at the ICU and you work with kids. Over the past 2 months, what is the difference that you have noticed, like since before the pandemic and after the pandemic, in terms of the atmosphere in the hospital itself? Like, do you see a difference?
Of course. I think the sanitation drives have increased a lot. My own personal hygiene. Earlier I used to just wash hands after seeing a patient. Mm-hmm. Now, हर बार आने से पहले, जाने के बाद, मरीज देखने से पहले, देखने के बाद, after even touching any surface, I try to wash my hands.
Right.
And then the level of mask and personal protection has considerably increased. Hospitals door यहाँ shut, वहाँ shut. There are new barricades from the entire hospital. का पूरा नक्शा has changed, because what they've done is there are 2 buildings in the hospital, and they've dedicated one entire building to a COVID care center where they keep the coronavirus positive staff patients and other quarantine doctors. But doctors का भी ये होता है ना, that if I am working in the coronavirus ward, which I am not right now, by the way, but if I am working in the coronavirus ward, even if I'm wearing entire personal protective equipment, I have to stay in quarantine for the next 14 days since my last encounter. So most जो कोरोना वायरस डेडिकेटेड हॉस्पिटल्स हैं, उनमें डॉक्टर्स को वो होटल में डाल देते हैं. So I have a friend in Lady Harding. So she's now for a month she'll be staying in Radisson Hotel because she's working in the coronavirus ICU.
Really?
So it's you have to seclude yourself from your home, from everything else, and then that's how it is.
Damn, man. So like all the doctors are being made to quarantine, and they've been sent to the Radisson Hotel. That's a good thing, man. At least like from the government's point of view.
That's a good thing. Yeah, of course it's a good thing. So
right.
Our hospital
in the middle of all this pandemic, at least they've been given some kind of a good service.
Yeah, I guess.
Please, not right now. Sorry, there's some disturbance. Yeah. So yeah, man, it's great. It's really at least those people. That's the least you can do for the healthcare workers, man. Like they are. I can't even imagine. I'll be honest, Aheed. I go outside to buy something. I get so scared. Like I feel like, oh my God, ye samne se kaun aa raha hai? I need to get away from him. And then there are other people. Then I need to get away from him. I can't even imagine being in your shoes and being a healthcare worker and being out there and being with the patients.
So this this thing, like Naman, this thing of being exposed to diseases, it's something not very new. Let me tell you like a small story. I was in my intern year, so हमारी internship थोड़ी सी hectic होती थी because I used to work in a government hospital then, and I was in the medicine department, and the medicine department की emergency is one of the most hectic emergencies ever. So we see like 100, 150 patients. Even I think we admit itna patients, and then we see even more than that. So I
On a daily
remember there
basis?
was, yeah. So we used to have
Okay.
emergencies twice a week, and it was a 24-hour duty, which we used to divide into 12 hours for every doctor. And in that 12 hour, we had loads of work to do. There was sampling, there was, tubes there, a lot of other stuff. So I remember there was this hepatitis B, hepatitis C positive patient, and there is a test called arterial blood gas. What we do is we take a needle and we put it here in the यहाँ पे, and it's something what an intern would do.
Okay.
So you have the radial artery here, but the moment you prick it gets in the blood. And it's a difficult process. It takes a lot of expertise. And I was very new. I had just started working in medicine,
Right.
and so I was wearing a mask. I was wearing my specs, and I don't know. I was doing it wrong or what. As soon as I pushed the plunger, the blood splashed onto me.
Oh no!
It came on my mask. It came on my eye, on my specs, on my forehead, everywhere. The only good thing was that hepatitis B is a very contagious virus. It is even more contagious than HIV and any other else, and it spreads very बहुत छोटा सा amount चाहिए होता है for that virus to be contagious.
All right.
And I needed, so I just got up from there and I ran to my senior. I said ये हो गया यहाँ पे, and she said okay, take off your mask, take off your chashma. And I took off that, and I asked her just check whether he's positive or not. And she kept checking whether he's positive. And turns out he was hepatitis B and hepatitis C positive. HIV का उसका test नहीं हुआ था. So and the only good thing was I was wearing my specs, so I had to throw away my specs at that time. I have to take off my mask. I have to sit down for a while, and I have to मुझे थोड़ा सा 5-10 मिनट दो, मुझे rest करना है, फिर I'll get on to that.
Oh my God.
So risk of exposure is something which is I didn't realize until I started working in the hospital that अच्छा हम भी हो सकता है. I had a senior जिसके heart में tuberculosis हो गया था because you know what, doctors they get exposed to TB patients so much that some of them even procure tuberculosis. There are so many doctors in India per year who get tuberculosis. So risk of exposure is a part and parcel of this job, and we should do as much as we. And the only thing against us is our own personal protection. कितना आप mask use कर रहे हो, कितना आप खुद को protect कर रहे हो. So that's something. Well, it's a bit scary. Even today, it's scary. No kidding.
Right. Wow. Dude, that was a scary story. Did you like get yourself tested for hepatitis after that? Were you scared? Must have been really scared.
Honestly, no, because then we checked the patient's antibody load, and it was not that much. So my senior said it's useless to get yourself tested. So I said okay, fine. Right. Although I had already been vaccinated against hepatitis B at that point, so it was not really recommended.
And then you see all of these people rallying against vaccines, like, oh, we don't need vaccines. Vaccines make you autistic. All this.
Yeah, recently I got to know that Djokovic is against vaccine.
Really?
I am really. I was really there is a list of celebrities who are against vaccine. Gwyneth Paltrow is one of them. And although हमारे देश में ये fashion अभी आया नहीं है, but I'm pretty sure ये आ जाएगा कुछ सालों में.
Like, dude, as a doctor, what does that make you feel like? Like, does it frustrate you? Like this kind of ideology? Like,
so I'm a pediatrician. I should be the expert on vaccines. Although it's a tough topic, मुझे इतना आता नहीं है अभी. It's something which happens when you actually actively vaccinate a lot. And my work evolves mostly around emergency work, so मुझे vaccinations का इतना नहीं chance मिलता. But still, a regular pediatrician knows everything about vaccines. And vaccination is one of the most important areas of income of a pediatrician.
Right.
And otherwise, अगर तुम देखो, vaccines have been so important. It is there in our government policies. It is there in the WHO policies.
Right.
It's something which
It helped
should be
eradicate polio. Like, why is polio not so prevalent?
it doesn't eradicate actually. So there's a difference between eradication and elimination. It
Okay.
has eliminated polio, but it has eradicate means completely world se khatam ho gaya. So that is only one virus, which is called the smallpox virus. Elimination means that for now the load has considerably decreased, and if that load keeps on keep on maintaining on the lower level for the 5 years, then we say that ye virus
So
eradicated.
polio has not been eradicated till now. It's become really less like prevalent.
It has become really less. Yes.
All right.
So smallpox is eradicated. किसी को smallpox नहीं हो सकता, लेकिन हाँ polio हो सकता है.
Dude, smallpox was really like, if you look at it, I saw some pictures on Google of people who had smallpox. They have all these like boils on their faces. It's really quite disgusting.
Throughout my life. Yeah, it was disgusting. And it used to claim a lot of lives. It used to cause this pneumonia, and it used to be very fatal at that time. But it is.
Dude, I want to come back to that topic of doctors getting infected with diseases. Like, when you became a doctor, you went through that event, like that thing happened, the story you told about, and then obviously now with the whole pandemic scene, do you see like did you think that you have enough equipment to protect yourself as a doctor?
Sometimes
available?
Yes, sometimes no. I think abhi to it's there. It has been given so much, precedence over other issues. But there was a time when we didn't have anything, even masks for that matter. I remember in my medicine OPD, when I used to go to the head sister to get a mask, she used to give me a mask ऐसे देखे कि कोई एहसान कर दिया हो. So I used to purchase one mask. Yeah, so it because of shortages, And
I can imagine why I said that is because earlier before this pandemic, people would have been like, why is he using so much equipment? What is the need? Maybe rationing the whole thing. And now they probably understand that, okay, they need to use it quite regularly because...
So honestly, ideally, you should always wear a mask when in an emergency department. But हम लोग नहीं पहनते. I remember even in med school, we were told कि कितना mask पहन लोगे, कितना बचा लोगे अपने आप को. कभी ना कभी कुछ ना कुछ होता है. So it's better to be a little fearless and do your work as you should be, instead of being like being scared all the time.
Right. But what do you feel about that personally? Don't you think it's a little stupid to be telling that to medical students?
Well,
you need to just buck up. Don't be scared. Just go inside the hospital. Come on,
medical colleges tell us a lot of stupid things. No kidding. You have to. So it's like that gym trainer now who tells you, "Ki, ye kar le," and then you end up, rupturing your muscle. Medical college is exactly like that. You have to find your own level of comfort as with dealing with patients. There are some professors जो कहते हैं बिल्कुल bookish रहो, idealistic रहो, just don't see what the situation is. कुछ doctors कहते हैं कि नहीं, you should be empathetic, you should check your patient, but you need to have a little balance with what you're going to do. So every doctor is different in that scenario. So what I do is I try to be a little bookish, but I try to bend the rules a bit sometimes when it is really required. So you have to find a balance of that. ज़्यादा bookish होना या ज़्यादा free flow होना is also not done.
Dude, but as a doctor, I think like you would imagine that doctors have really good, health balance. Like they know what to do, how to take care of themselves and how to take care of stress.
Doctors are the worst patients. I personally say from experience, I had a very bad pharyngitis once, and I was almost.
What did you have? Sorry.
I had sore throat fever, very bad, very bad. It was extremely bad. It actually caused. I had a fainting episode as well. It was very bad. This was in 2017 when I was preparing for my masters. Yeah. So I had stitches here and काफी पंगा हो गया था.
Stitches? Like you fell down? कुछ लड़ाई बड़ाई?
I fell down because I was so weak. I was not eating for the last 2-3 days, so I actually fell down. And so I was the worst patient in that hospital जहाँ मेरा roommate ले गया था मुझे. I'm not a good. So doctors are not good patients at all. At least I am not.
That too, as a med student, you were a patient, like just because of the stress, like, just studying for so many
In the,
hours, or
yeah, because although of course even so whenever a patient comes, right, a random person who has some disease and he knows कि अच्छा नहीं सब कुछ ठीक होगा, he has that hope. But doctors का क्या होता है, we know the end story कि आखिरी में क्या होता है इस डिजीज के, या वी नो दैट अगर ये वो निकला तो ये हो जाएगा, अगर ये निकला तो ये हो जाएगा. So I think there's a lot of mental stress involved. I think this happened in the dengue epidemic in my first year of masters when I had started some fever and I was having pain abdomen and I thought अरे यार मुझे dengue हो गया, अब तो मुझे ICU में भर्ती होना पड़ेगा. And this is such a rampant thing among doctors because we read so much and we know about the disease so much that even small symptoms seem like it ultimately sometimes it doesn't happen, sometimes it does happen. मेरे साथ नहीं हुआ है आज तक कभी. But yeah, it creates a environment of mental stress, of course. No
does this
doubt.
happen in hospitals? Like, if you're having some symptoms yourself, but then you have to come to hospital, jana hi padta hai, can you tell your senior that, hey man, like I don't feel good, but he's like, dude, come on.
It is possible. Until unless you are that sick. So this is what every senior I think must have told once or twice to their doctor, to their juniors. जब तक इतने बीमार नहीं हो तब के बिल्कुल ही खड़े नहीं हो सकते, काम नहीं कर सकते, तब तक हॉस्पिटल आना चाहिए. That's what they have told me. But if you are ठीक ठाक, थोड़ा सा फीवर आ रहा है, if you are able to work, then it's better to come. But I would recommend against it.
I get that. Man, he tell me something. What can somebody do, like a average person right now, who's been given so much information, like like so many people are dying. It's almost like a cricket match. You know how you open the website and then you see India 258 and then Pakistan, all that shit. Like it's almost like a statistic game going on. Like so many deaths have happened, so many people are affected. There's so much information overload. What are some of the basic steps do you think a person can take to not just like stay away from this virus, but also just boost his immunity, like his or her immunity? How do we equip ourselves to better take care of ourselves? I want to hear your opinion about that as a doc.
So first
Even
of
though,
all,
like, sorry to, but like, even though I just heard about all your stress stories, man, like it's so crazy. I wonder what your own immunity is like right now, with all this stress.
I don't know about my own immunity, but I know that itna to karo ke catalog your information sources. I think that is important. If you are getting information, if you're getting information from one source which is giving a lot of crappy bullshit, sensational news, तो उस चीज को खत्म करो. Even I was telling my parents that अगर news ही देखनी है तो 1 घंटा रात में that should be your news duration. उस 1 घंटे से ज़्यादा दिन में इतना कुछ नहीं होता that you cannot summarize, and there are a lot of news channels which are summarizing it at around 8-9 p.m. सारी news वो 1 घंटे में बता देते हैं. Just watch that if you are really affected by all this information, or if you're following anybody on Instagram or following some sites, then follow one person who you think is authentic, क्योंकि वो बंदा फालतू की न्यूज़ नहीं डालेगा. और if you don't want to follow anybody, just go ahead and follow the ministry website, और वो भी नहीं पसंद तो WHO website follow कर लो.
Yeah, but dude, when WHO, I heard something really quite mind-blowing. Like in January, in the first week or something around that, they were saying that it doesn't spread from person to person. They themselves were contradicting the reality.
So, Naman, देखो इसका ये चीज समझनी पड़ेगी that medicine is not an exact science. 1+1 हमेशा 2 नहीं होता. 1+1 अगर आज 2 है तो वो कल 4 भी हो सकता है. We don't know that this virus is stable enough to not mutate. Now, why have we not created vaccine against this HIV virus? Because HIV virus replicates As if you make something, it will replicate the next day into something else. So we don't know yet. Imagine HIV
Hmm.
virus has been there in the world since 1960s 70s, and abhi tak we haven't been able to make up a vaccine. We haven't been make up a vaccine for most of the viruses efficiently. The new ones, the rotaviruses, other viruses.
Right.
तो 3 महीने में this virus has taken over the world, and you expect anybody to not make it's you know it's like
Right. There was
how should I put
uncertainty. Lots of
it?
uncertainty.
And honestly, at that point of time when WHO made this, it was only thinking about the information and the reports which were coming from China.
Right.
अब वहां से जो रिपोर्ट आएगी उसी की बेसिस पे तो they would do anything. Now if they started having human to human transmission, I'm pretty sure that WHO might have updated it. It's something which is up now. Now there is now abhi tak news see that it is not affecting kids that much. Now there have been news in UK and in US that kids are getting affected with a special type of a rare syndrome, which is worse than that. So the virus is a little, as we grow and as we see more cases, we are we are we're knowing more and more about what is the clinical spectrum of the virus.
Right.
And clinical spectrum को जानने में थोड़ा time लगता है. You see tuberculosis. Tuberculosis is a bacteria. It's not a virus. Tuberculosis was discovered in the 14th, 15th century. And abhi tak we see new areas of presentations of tuberculosis. You see how
Hmm.
much time has elapsed and how much little that we know about tuberculosis. Every day we
Right.
see new presentations. So इतना ये जो ट्रम्प वाली जो मेंटालिटी है कि भाई एक वैक्सीन होनी चाहिए, वो जादू की छड़ी होनी चाहिए,
Right, right.
एंड
ऐसे नहीं
ये
चलेगा,
नहीं
मतलब
होता,
ऐसे होगा नहीं,
ऐसे
ऐसे
नहीं है.
हो भी नहीं सकता. Now that you put this into perspective कि इतनी diseases पहले history में रह चुकी हैं, all of these things have been discovered, but they're already there even today. So to
Yeah, so
expect scientific community to just come out with one brilliant solution and it just everything gets everything is solved, that is
exactly.
not how it
So
goes.
exactly. So about hydroxychloroquine, there was a time when all the I think only two to 1 or 1.5 months ago, the Indian Council of Medical Research they recommended कि सारे डॉक्टर्स को हाइड्रोक्सीक्लोरोक्विन दे दो. और अभी एफडीए ने बोला कि नहीं मत दो क्योंकि उससे जो है साइड इफेक्ट्स ज्यादा हो रहे हैं एज कंपेयर टू बेनिफिट्स. सो वी आर स्टिल लर्निंग मोर एंड मोर अबाउट व्हाट दिस वायरस कैन कॉज और व्हाट इज द पॉसिबल मैकेनिज्म, एंड ये सब बहुत धीरे धीरे होता है. Everything that we have learned till now, every vaccine, every medicine, every bacteria, it has gone through years and years of research, slow research, and that's how it has became available as we see it now. It's not that कि 90s आया और suddenly सारी दवाइयाँ available हो गई.
Right.
That's not the.
And that's also true that it takes a little time to develop a vaccine. मतलब थोड़ा time लगता है. You have to test it on first animals, then you have to test it on humans.
Yes, अभी even if you fast track the human thing, it takes 6 months because suppose तुमने वैक्सीन बना ली 1 महीने में, मैं एज एन एडमिनिस्ट्रेटिव बैठा हुआ हूँ, मेरे से हो कि वो वैक्सीन सब हजार करोड़ों लोगों की तरफ जाएगी. So do you think I can be 100% sure that this vaccine is not causing any problem? So I would rather give 100 people these vaccines than I'll give 1,000 people the same vaccine, then I'll give 10,000. And
Right.
उन सब में मैं देखूंगा किसी एक में भी डिजीज नहीं होनी चाहिए. उसमें से किसी एक को भी हो गई तो I will discard the vaccine.
That
Then
is
you have to
tricky.
start that.
That is very
हाँ, so
tricky.
that is all. That's very important. Imagine you giving a live virus to somebody who
Hmm.
doesn't have the disease, and it happened in polio. It still happens in polio. So you do a polio vaccine, and sometimes 1 in 1 lakh or 1 million of the child he develops polio,
Oh my God.
which is called vaccine-derived polio (VDV), and it's scary for the parents. So वो vaccine
Right.
कराने गए. This is what is the rationale behind non-immunizationals who say कि आप अपनी बॉडी में कुछ डाल रहे हो उससे साइड इफेक्ट्स हो जाते हैं, कभी कभी
Right.
निमोनिया हो जाता है. So it is a risk. No kidding. Yes, it is a risk. But you see, there are 1 million people getting the benefit of it, and if one is affected, so a lot of it comes down to it. Yes, if you having some side effects from the vaccine, then they should be addressed, they should be reported, and the vaccine should be updated. So just you see such side effects of any vaccine, sometimes they even take the entire vaccine out of market. ऐसा हुआ है. कई
Wow.
सारी vaccine market में आई and then they developed side effects and they were taken off the market. So this is how the pharma industries actually work, and we have to bear patience with that. पर हाँ एक साल से जल्दी में कोई भी कोरोना वायरस की वैक्सीन. That is why I think a lot of research should be directed towards. I know that's not a good thing to say, but as for now, I think we should keep working on the vaccine, which is the primary prevention. But we should also do something for the secondary and tertiary prevention, which means that we should know कि कौन सी दवा उसको treat कर रही है. We should work more on the treatment now because people are dying as we are working instead of vaccine.
Right. Vaccine would be the solution, but getting those tertiary medicines would make sure that the existing patients जो already जिनको corona है वो recover हो जाएं.
वो severe वाले patients तो at least recover हो जाएं. So
Right.
at least for this year, I think research on drugs and research on treatment is far more important and urgent than vaccine. So इतना hope vaccine में नहीं लगा हो अभी जितना treatment में लगाना चाहिए. And treatment is, I think there was a drug called remdesivir which is working. There are other antiviral
Can you
drugs
repeat that,
which are.
please? The
There is
name?
a drug called the remdesivir, Remdesivir. I actually did a video on remdesivir. So it has shown very good results recently. So क्या हुआ था जब चाइना में ये हुआ, so they started modulating कि कहाँ कहाँ वायरस को अटैक कर सकते हैं. One of the drug was the DNA making machinery जहाँ पे हम वायरस को अटैक कर सकते हैं. उस ड्रग का नाम है रेमडेसिविर. रेमडेसिविर को उन्होंने, क्योंकि उनके पास कम पेशेंट्स थे, तो what they did was they took around 158 patients and उनको वो दवा दे दी. But that बहुत कम sample size है, ये बहुत कम लोगों पे वो दवा दी. So it was a very unconclusive drug. So in February or March start, the US में remdesivir के trials start हुए, and it started on around more than 1,000 patients. And recently, I think a week ago, their results was in, and they showed that remdesivir can be an emergency treatment for severely affected patients. So they will be giving remdesivir.
Nice. So at least there is some research going on in terms of which medicine can help the existing patients for treating them.
And then we also have the plasma therapy where they take the antibiotics.
Tell me about the plasma therapy. So as far as I understand, plasma therapy is when like a patient is cured from coronavirus, they take some of his plasma and give it to the patient who has coronavirus, right? Is that plasma therapy in simple terms?
I think they take the antibodies against the virus, and they give it as a form of passive immunity to somebody who's severely affected, so that he has a chance of. Although इसके अच्छे results भी हैं. There was a patient who was intubated, and because of this, he suddenly started improving. So yes, there is a positive scene happening there. There is patients who are improving because of plasma therapy, and then it also helps the people who are being treated or who have recovered from coronavirus. And the good thing about this is that our body completely cleans out the virus. It doesn't leave out traces
through plasma therapy.
No, naturally as well.
Okay.
So if I got the virus and I come and I don't have any symptoms, then at the end of my disease, I would completely clear out the virus. There would be no virus in my body whatsoever. Irrespective of other viruses, for example, HIV, which still stay in body fluids, or syphilis or herpes, who get inside our body and they stay.
And they will stay.
They will stay. But this virus,
as opposed to coronavirus, which might go away in a few days.
So the point is that you make antibodies which can completely help patients who are currently having a very severe. So what coronavirus actually does is it creates an immune storm in your body, and just say your own. So immune storm is a very it's like machine gun, right? So वो body पर start कर देती है, वो देखती नहीं है आगे क्या आया. body cells आए या virus आया, it doesn't care. And,
blow this
so
thing away.
that is the response mechanism of against, and it does only for very severe affected viruses. For example, staphylococcus के साथ ऐसा होता है. Staphylococcus is a very common bacteria, you know. It's there on your skin, it's everywhere. जितने भी ये acne होते हैं and हाथ में infection इधर उधर जो भी skin में होता है, it's caused by staphylococcus.
All right.
And staphylococcus के against body has a similar immune response. So there are syndromes which are similar to the staphylococcal infection happening with coronavirus, which means that the body is showing a similar sort of a response as it shows against staphylococcus with coronavirus, which is a scary thing. So we need to suppress the immune system, and that is why we give drugs which suppress the immune system. Hydroxychloroquine is also an immunomodulator. It actually curbs the immune system down, and उससे क्या होता है वो उसकी machine gun थोड़ी कम हो जाती है, and then it really kills the viruses and not the human cells.
But that is such a I mean, it's such a contradiction, because one would think that you want your immune system to really go after the virus, but what you're trying to do is to control it down.
It's a very common.
Fill it out.
You see,
hydrochloroquine.
Because our immune system is a very strong machine. It doesn't give a shit if you want. I don't know if I can say shit. But
you have to explain.
It's a very strong. The chemicals which are used in the immune system, it's something which can dissolve your own body. And sometimes when they get in hyperdrive, it causes diseases. For example, there is a disease called rheumatoid arthritis.
Rheumatoid arthritis, right? I've heard of this.
उसमें क्या होता है that the body started attacking its own cell because the immune system is in hyperdrive. So it forgets कि भाई bacteria है चाहे नहीं है, but it thinks that the entire body is somewhat foreign. So the immune system has somewhat of a memory of its own, and it starts attacking the normal cells. So we have to give steroids, and we have to suppress the immune system. Wow. This happens in a lot of other diseases where we know that bacteria तो इतना strong नहीं था, लेकिन जो immune response आया वो बहुत ज़्यादा strong है. And we need to handle the immune system first के यही ना मार दे. And कभी-कभी immune system kills the own body. It starts attacking blood vessels. It starts attacking muscles and heart, and it just creates a cascade which kills the person.
Wow.
So we need to reduce the effect of the immune system first. And this is what exactly is happening with coronavirus, that the immune system is responding with such great vigor that even though this virus is causing only infection in the lungs, the entire body gets involved dramatically.
Do you think it's because this virus is a novel virus, like it's something that the body has never seen before, and that's why the immune system is behaving the way it is? Because once you have a normal flu, which you have annually, har saal flu hota hai, then maybe the immune system doesn't kick as hard as something that is completely foreign.
Naman, this is a very good question. This is a question which every scientist is asking right now. कि भाई ऐसा क्यों हो रहा है? Novel virus हुआ तो क्या हुआ? Why is the body responding so dramatically? Why is it happening? We don't know that yet.
Wow.
We don't know that ये influenza में नहीं हो रहा है, लेकिन कोरोना में क्यों हो रहा है? Why is it happening? So, and even though, and कुछ लोगों में हो रहा है, कुछ लोगों में नहीं हो रहा है. Is there genetic susceptibility? Is there environmental susceptibility? Like, right. Why is it happening? We don't know yet because we're not researching it yet. अभी हम दवाई बनाने में जुटे हुए हैं कि वायरस के बारे में जानना is थोड़े दूर की बात.
Right. And काफी लोग, people are also talking about, does it have to do with your lifestyle? Like if you're a smoker or if you're a drinker, does it make you more vulnerable to be a fatality if you get the coronavirus rather than somebody who lives a healthy lifestyle?
This is all trends. There is no conclusive evidence.
Right.
It has been seen to happen more in men. It has been seen to happen more in men with comorbidities like diabetes, hypertension. उन लोगों में भी देखा गया है जो कि स्मोक करते हैं, but the level of severity is not related. Supposedly, if you have a disease because of smoking, then yes, of course, it can aggravate it. But if you are like a young person who is smoking, आपके में होगा बहुत ज़्यादा chances हैं, because smoking has you're, first of all, you're using your hand, you're bringing it to your face, and आजकल तो लोग if you really want to smoke, I would say, I mean, this is something that I thought I should tell. If you really want to smoke, just first of all clean your hands, use a sanitizer instead. Hold the
All
cigarette
the
in only
smokers,
one
pay
hand.
attention. Sorry.
Yeah, hold the cigarette in only one hand and just keep it there. Don't let your fingers touch your mouth. उसको तुम butt को touch करोगे, इसको touch, and throw the finger before it hits the end. Throw the cigarette, sorry, before it hits the end, so that you minimize contact. थोड़ा सा, I know cigarettes are all costly these days, but if you really want to do it, तो
that's the way to go
इतना
about
करो,
it.
अपना face को अपने मुंह से touch मत करो. And don't touch the other part. Only just touch your cigarette like this, and then that is it.
Damn.
Don't. Although I would still recommend not to do it.
Yeah.
But sometimes if you really want to do it, just
don't smoke. But man, I mean, it's so hard to tell people what to do and what not to do, because nobody has been in their home for 50 days for this long a time, and just virtue signaling is the worst thing one can do right now. You should not do this, you should not smoke, you should not drink alcohol. Like, do what you have to do, but just stay inside.
We have been so much into social. We were social, right? Humans are social. They can't live without society. And suddenly you're telling them कि नहीं घर पे रहो, don't meet people. It will not happen. I'm just happy that this virus is not affecting the brain. Imagine, have you seen that movie Contagion?
No.
It is quite a possibility. Please go and see Contagion.
I'll watch this. Contagion. What is it about?
So it's a virus which breaks out and it causes a global pandemic, and it's scary because it kills people in 7 days. So it actually kills them. It has some very good cast. It has Gwyneth Paltrow, Kate Winslet, and Matt Damon, and it's something very. You can see you can just see in that movie that अगर ये coronavirus would have been lethal, then क्या हाल होता हमारी world का. It just gives you that particular, thing.
So, what I got from that is that coronavirus itself is not lethal. It's the comorbidity of a patient that can kill the person.
Yes, of course.
Mostly.
It creates an immune response which affects the body. Right. But yes, since it's causing because of the virus, we still consider it lethal because it is affecting the body as well.
Mm-hmm.
But yet, we still have to see how we would be able to deal with it.
Right. Dude, this question might be a little out of your expertise. I mean, what I mean by that is because it's conspiracy, so I know doctors, yeah, it's like, you guys deal with patients, you were there with the real people, giving them medicine.
I'm quite open to answer conspiracy theories.
No, but you might have an opinion about this because you are in you're in the red zone, you are with the people, you think about this, it's in your psyche somewhere. So I want to know that, do you think it's possible that this virus got leaked because of a bat, or do you think it's because of that have you heard of this the lab in Wuhan which has like all these viruses inside a building, and it got leaked from there, or intentionally or non-intentionally? What do you think, like this, how did this virus get leaked?
So I have a very a research is actually published which has shown that the virus which is outside, I'll share it today on my Instagram. It actually shows that the virus is not lab leaked. It's a wild type virus. There is a research done for this, and it's actually presented to the President of the United States and to the world that this virus is not leaked out of a lab. People were having conspiracies. They did a research and they took out the genome of the virus which was there inside the lab and the virus which is there outside the lab, and there are considerable differences. So what we are dealing with here is a wild type. A wild type means that the virus has mutated outside the lab. There's a full-on study and a research on this. So It just takes off the conspiracy off the table.
Do you think, because viruses exist naturally. Like it's very difficult. Like people think you can create viruses, but I think that's more difficult. You just take an animal and liberate the viruses, and
It's not easy to create a virus. Viruses are inanimate objects which actually become alive inside the human body or inside anybody's body, inside a cell, which I should say. And it's not easy to make them. It's
Right.
actually, we have not created a single artificial virus in the history of humankind.
That's a very important point
It
for all the
is it
conspiracy
is
theorists out
very
there.
difficult to make something like that. They exist naturally. I think there is this. You should really see that there is a documentary on Netflix. It's called Coronavirus Explained. You should watch that. तो उसमें उन्होंने ये बताया है that a lot of viruses, they still are there in the wild. They still exist in the jungles. Now, as we cut off these jungles and we cause animals to live together, especially bats and pigs and swine and all that, and when they live in closed compartments, for example, pigs को ये एक के ऊपर एक रखते हैं. Now imagine in that shed there is a bat who has that virus. That bat sheds some fecal matter onto the pigs. The pigs eat them. The pigs have the same virus. The virus has the same virus. Both are non-lethal viruses. They get inside the pig's body and they replicate and they create the coronavirus. Now when the pig is eaten by humans, they get infected into humans. This is how the most plausible explanation of how coronavirus came into existence.
Damn, man, this is it's like we're cutting our own branch as human beings, because if we're cutting more forests and more animals are getting domesticated or even becoming farm animals,
In the wild.
we are going to liberate more viruses and the entire society. I think this is like a post-disease era we're heading into, because we are gonna cut more forests.
Amazon
That's the
has
way
so
we
many.
are.
There is a cave in China जहाँ पे कई सारे bats रहते हैं. So the Chinese officials, when the SARS virus outbreak happened, what they did was they take these bats and they check these bats for wild viruses, and they have found thousands and thousands of viruses which are there, thousands of coronaviruses. Any one of them can mutate in the future.
Wow.
And how does that happen? Humans go there and they cut off their trees, they cause these bats, they capture these bats, they keep them in close proximities. Let's not say that they eat them, but let's just say that they keep them in captivity, and they're basically exposing the wild types to humans yourself. So we need to have a balance. No kidding about it. We still don't know a lot of viruses in the future which can come up.
Wow. Holy, like you would think that this is the best way for a country to, if a country like China, it wants to, completely break down the economy of the entire world. I mean, this is against conspiracy theory realm, but if you have to think of a country wanting to, sabotage another country, you don't want to shoot missiles. You don't want to drop a nuclear bomb. All you do is just, release a virus, and you have a situation where thousands of people die without you shooting a single bullet. So this is, I mean, I'm not saying that they have done this, but what I'm saying is that this could be the reality of the future. Like this is how biological warfare happens. And this is where people like you become really important. I mean, doctors have been important for centuries, and in our Indian society now we're starting to see them getting attacked, and that is so insane. I mean, it's so stupid, but there's also a lot of respect for doctors. But your role in society is almost like a soldier with a gun now.
If so,
I think so.
I should say, but yes, biological warfare is a very scary thing. It is scarier than missiles. It is because it affects innocent people, and without any repercussions. You can't blame anybody. uh, you just can't stop it. And ये इस वायरस के साथ भी कुछ ऐसा ही हो रहा है. See, I am open to discussion, but I really hope that this should not be biological warfare. First of all,
Right.
any biological warfare is actually dependent on known pathogens. जैसे anthrax था. So what happened was in do you know what happened with anthrax?
No. Please tell me.
When 9/11 happened, people started receiving envelopes of dust which had bacillus anthracis or anthrax spores. And the moment you open the envelope, the spores come out and you get the virus. You get the
Really?
bacteria. Yeah, it's
This is
called
post
anthrax.
9/11?
Anthrax. This is post 9/11.
But
This is
why
was
would,
actually
who did this?
part of 9/11. It is very very big in US. People got a lot of anthrax because of this. It
Holy
was it
damn.
was
I've heard this word
uh,
anthrax. I have heard about it, but I did not know that it was sent through envelopes into people's homes. That's
yeah.
insane.
That is what terrorists did. They sent people envelopes with bacillus anthracis spores, and this is a documented event. I'm not making this up. And
Lord.
now imagine something like that would have happened. So many people started developing anthrax because of
Yeah.
this. Somehow they controlled it, and I think that I hope this is not biological warfare, because one, this is a novel pathogen, and novel pathogen banana is out of the question for humankind. I hope so. I really
Release
hope so.
karna, like banana is a different question, but what about just putting it out there? Like,
So
is
क्या
there a
होगा? You can get infected. The person who will set that virus free in the will get infected सबसे पहले.
right?
So
But the
it's like
government be like,
suicide bomb.
okay, a few doctors die, who cares? But at least the US economy falls, so I'm happy. And
No, because it will affect. It will even you can get affected, right? The person who made the virus can get affected first. The person who spread the virus can get affected first. His family can get affected first. The 100 radius of patients, people in that area could get affected. So it's really not you know a good deal to release the virus. It's unadvised. Even
right,
if you want to.
yeah, I mean, you don't. I personally don't want this to be true. Like, I don't want biological warfare to be true, because if we think that these things are actually real, then this is the worst we can expect from human beings. I mean,
Exactly.
human
I
beings
hope
do
it.
such great things. We have doctors, we have engineers, we make buildings, we make, we do charitable things. We do a lot of good things for the nature and for ourselves as well. But we are also capable of a lot of negative actions. And if biological warfare becomes the new norm, then I think we're headed in a very weird direction. And I think, like, do you think the Indian healthcare system is ready for another pandemic of such sorts in the next, say, 5 years? Say if there's another
You
outbreak.
know what? Recently, Delhi CM said that something which this virus has taught us is that in 71 years of our existence as an independent country, we have not given enough stress and money to infrastructure in healthcare and to doctors. And now, for the first time, doctors are getting the attention. I would not still say respect, but I would still say attention that they need. चलो हमें रेस्पेक्ट मत दो यार, हमें हॉस्पिटल में आके मारो तो मत. उतना ही नहीं करोगे तो डॉक्टर्स खुश हो जाएंगे. हमें क्या लेना है किसी और से? We are there to treat you. We're not there to gain your respect. It's okay if you don't want to respect us, but at least don't come and kill us. I have a friend whose father was actually killed while treating in the clinic. Two goons came into his clinic and point blank shot him in the head. And itna to nahi karo, right? So if that thing doesn't happen, I think doctors will be more than happy. And now you should really see, I mean, if anybody wants to say na कि doctors ये काम करते हैं, doctors वो काम करते हैं, ये पैसे arrange करते हैं, just go to a government hospital emergency. Just go and stay there for 1 hour. 1 hour would, clear all your doubts. कि डॉक्टर्स क्या करते हैं, डॉक्टर्स क्या नहीं करते हैं, लोग कैसे होते हैं, लोग कितना गुस्सा करते हैं, लोग कितना मारते हैं, क्या गालियां बकते हैं, जितना डॉक्टर्स को जितना भी कुछ करते हैं, just एक गवर्नमेंट and how actually they live and how much surroundings that they actually have to deal with.
Right.
Let me tell you, this is very disgusting, by the way. I There was a ward in my hospital which used to leak when it used to rain. This
Really?
was filled with patients. Yeah,
Where was this?
this was in my UG hospital, GTB hospital, and now they've all renovated the
Mm-hmm.
hospital. But in my UG time, it was
Thankfully.
not good. It was not in a good condition, and every bed has two patients. And these patients were all respiratory patients, which means that they had cough, they had phlegm, they had everything, and they used to spit on the floor, and they used to do this. Now imagine the water coming in, and there is a swimming pool there, and everything is floating, and you have
Uh,
to go to that area and work there 12 hours, 24 hours. Anybody would be able to work? They would get really agitated and infected because of that.
Holy shit.
This is
That's
the
like a
condition in
cesspool.
which doctors exactly. So this is the condition in which doctors live and work, and sometimes even sleep. तो वो जो भी कुछ भी बोलता है ना डॉक्टर्स के अगेंस्ट, तो मुझे तो वो हाल याद आता है in that hospital, that I have worked there, I've lived there, I've slept there, and I want everybody else to go and see them. If they can live, work, and sleep there, then I'll be able to listen to their any argument.
Right.
Otherwise, I'm not really keen to listen to any argument.
Holy. And it's like, what this incident you told me about how the doctor got shot. That is so disgusting, man, because the doctor is working. He doesn't just have the pressure of trying to save someone's life. He's also scared for his own life. How is he going to perform on the patient?
So before this pandemic,
Wow.
I was all these 3 years I was in my masters. I was under this impression. I think this is even true that doctors now अब service providers हो गए हैं. हम आएंगे, हम पैसे देंगे आपको, and आप हमारा इलाज करो, and then get out of our lives. This is how it has been. And if in some cases, if there is any medical accident or in medical mishap, I don't say negligence, but if there is something just 1+1 का 2 नहीं हुआ, मान लो hospital stay 3 दिन से 4 दिन या 5 दिन हो गया, तो डॉक्टर की वो उसकी रेड लगा देंगे, उसको उस पे केस कर देंगे, उसको वो गालियां बकेंगे, उस पे चिल्लाएंगे, उस पे सब कुछ उसको हैरेस करने की कोशिश करेंगे. So this has been, even though if you go to a grocery shop, you don't misbehave. Imagine everybody misbehaves with you ask any doctor, has any patient misbehaved with you? The answer would not be no.
That is so insane. Dude, Aheed, I wanted to ask you something like, there is in one hospital you have the doctors and then you have the administration. A lot of people who go to the hospitals, they complain. वो बोलते हैं कि हमें ज़्यादा रुकवा दिया, like हमें 5 दिन का काम था, 20 दिन का बिल कर दिया, all these things. So I'm not saying that maybe they needed to be there, but आपको लगता है कि somewhere administration staff also does something stupid to bill people extra? Like, do you think that exists? I'm not saying that doctors might do this, because doctors know they have to treat the patient, but the administration staff has its incentive in making money because they take care of the balance sheet.
So first of all, you have to understand that if it's a corporate hospital, they are not there to just treat you. They're also running a business. If you are running a business of your own, you would not do anything without getting paid, right? They are doing everything well within their rights. डॉक्टर्स को भी फैमिली होती है, उनको भी पैसे कमाने होते हैं, उनको भी जाके फॉरेन में वेकेशन करनी होती है, उनको भी अच्छी गाड़ी चाहिए होती है. They're just doing something in the simultaneously, which is improving lives of other people. But if they're charging you for that, there is nothing wrong with that. Now comes in a corporate setting. Corporate settings are no kidding. They are costly. They are costly. First of all, they're giving you services which the government hospital is not.
Right.
So they would.
You just sorry to interrupt, but you just explained the site of GTB hospital where the mucus is flowing on the floor. Do you go there, or do you want to go a place which has a clean floor?
Exactly. So imagine you would.
It's sad I have to say this, but like government hospitals suck. They're the worst. They're so bad. Like I don't want to go to a government hospital ever.
Yeah, so you need to understand that there is somebody is providing you clean. Imagine if there were no private hospitals in our country, our healthcare would have been saturated. गवर्नमेंट हॉस्पिटल होता ठीक होता, बट अभी भी इतना सैचुरेटेड है. Imagine if the elite population would have been there, it would have remained more saturated and more filled up. So if some hospital is providing you with some basic amenities, for example, like an attached bathroom, single rooms, one patient on one bed, this is basic for India, by the way. So they should charge you for some money because they are providing you with this. Now comes on to the extra money charges. Sometimes hospitals need to make ends meet.
Mm-hmm.
For example, in my hospital there are an 8-bedded pediatric ICU, right? Two of those beds are reserved for poor sections of the people, and these 2 beds are filled by, which is run by the hospital. Now the cost of running a patient on ventilator for one day is around 150,000 to 1 lakh per day.
God damn, that's a lot.
So that's a lot of money.
Mm-hmm.
So either we ask you if your child is on the ventilator, or we ask the government, or we take it out from our own pool. So what the hospital does is, since it's a semi-private hospital, it takes some part of the government, it takes some part of its own money, and it keeps you 2 beds for those poor sections of the society. बाकी के जो 6 बेड है वो दूसरों के लिए रखता है. Now if you're admitted there, so why should the hospital not ask you?
Right.
It's a clean thing.
Right. It's a service.
And then,
you're paying for a service
yes,
at the end of the day.
And then there comes sometimes people say कि हमें तो भगा दिया उस हॉस्पिटल से. तो 6 बेड हैं, 6 के 6 बेड में वेंटिलेटेड पेशेंट्स हैं. आई एम द डॉक्टर ऑन ड्यूटी, राइट? एक मरीज आया जो कि बहुत सिक है, ही नीड्स वेंटिलेटर. तो मैं उसको क्या बोलूँगा कि नहीं हम आपका एडमिशन करा देंगे. I will tell him the truth, right? There are 6 beds, 8 beds. All of those 8 beds are occupied, and this child needs an ICU. He needs a ventilator. I can't keep him in the hospital or in the emergency area, because if I keep him in the emergency area, what he might die in the next 6 hours. If he wasn't on a ventilator, his life would have been saved. But अभी क्योंकि है ही नहीं ICU, हमें रेफर करना पड़ता है. तो कई लोगों को बुरा लगता है कि हमें तो रेफर कर दिया, इतना बड़ा
हॉस्पिटल है. And there's just 6 beds, man. 6 is nothing. 6 is like you can put it on your hand. 6. There are patients where like you have a lot of patients who need ventilators.
Yeah,
that's why the whole debate about ventilators is happening, because ventilators are not enough.
Exactly, and it happened in our country in June, because in 2016, 2017 when the dengue epidemic was there.
Mm-hmm.
तो इतने सारे मरीज आते थे जिनको वेंटिलेटर की जरूरत थी, but we were not able to give them because we didn't have any ventilator. Imagine in a tertiary care hospital like Max Patparganj, there are 6 or 8 pediatric ventilators, and there are other hospitals like Chacha Nehru, and there are other hospitals like GTB or Lal Bahadur Shastri. These are major hospitals in East Delhi. And इसमें भी कितने वेंटिलेटर्स होंगे? 5 या 6 से ज़्यादा तो नहीं होंगे ना. तो अगर हम लेके चलते हैं 10 हॉस्पिटल्स, अगर 4 हॉस्पिटल्स हैं और उसमें 10 वेंटिलेटर्स हैं, it still comes on to 40 ventilators.
That's
the dengue epidemic caused around 200 to 300 ventilator use per day.
My God.
So you can imagine how many people would have died. 40, 200. Our health infrastructure is already very crippling, and we need we have so much of everything, right? We have the best architecture, we have the best buildings. सब कुछ तो हम अच्छा कर रहे हैं. Health में भी करें ना कुछ.
Right.
Doctors जब भाग रहे हैं इंडिया से, because they're not getting the respect. Second, they're not getting money. Third, they're not getting the amenities. अगर हम अपने पूरी श्रद्धा से काम भी करना चाहें, then we don't have anything here to tell the patients. हमारे पास ventilators नहीं है, तो क्या बोलेंगे हम मरीज को?
That must be so frustrating as a doctor when you don't have enough equipment to treat all your patients.
It is, and it backfires sometimes. Sometimes the patient, started screaming at me.
Oh my God.
क्योंकि मैं उन्हें बताता हूँ कि ventilator नहीं है. So then we have to explain them this entire thing. So this entire thing on ventilators, I had to explain almost in every duty. I have to make the parents sit and understand. Sometimes the parents understand, and sometimes they don't. When they don't, they start bashing at me. मुझ पे चिल्लाते हैं कि इतना बड़ा हॉस्पिटल है, आप डॉक्टर हो, पैसे हमसे ले रहे हो, फिर भी आप हमारा एडमिशन नहीं कर रहे हो. What is going on? You are this, you are that. and
Man,
then so we have to deal this on a daily basis.
man, this is so moving, bro. And I mean, one would think that doctors, they're professionals, and now that you've become a doctor, life is going to be easy, everything is sorted. But I think it's such a challenge, especially in a country like India, where the health infrastructure needs a lot of thought. Like कुछ structural problems हैं अभी भी हम लोग. We are not ready for such pandemics. We're not ready for a lot of we're not ready for our population. We are so populated, and we do not have the equipments and the
Someone,
mentally.
give me just 2 minutes. Sorry to interrupt. I
No,
have to, put my laptop on charge.
no problem, no problem. But just the point is, man, like your job is such a pressure job, and people need to understand that respect has to be given. And I'm
No, it's
glad.
okay. I mean, people need to understand not to that doctors, first of all, are just human beings, and they cannot. Sometimes they cannot protect everybody else. They have to. There exist a lot of limitations on how our. So I have two
You're giving me a
cats. You
small
can.
tour of your house. Nice.
Yes. I have to.
Dude, but man, really, this is such a this is. I'm so glad we had this conversation, Aheed, because people. I mean, yes, our prime minister is coming, and he's saying that we need to respect our healthcare workers, the frontline workers. We have to respect them, give them, shower petals on them, and all these things. But it has to happen from the individual. Every time you see a patient in the future, they should look at you and know that you're a human being, and not just like a machine who's just going to 1 + 1 2, and everything is sorted.
It's Naman, it's not always that bad. So my cats are here.
Hey, no problem. It's all right. Your
So
feed is frozen.
everybody need to understand. Hello,
Yeah, now it's
is
good.
it okay?
Yeah.
So we need to understand that a lot of the doctors, first of all, it's not all bad. There are parents who go out and they ask me, they thank me sometimes, and they're very nice. Exactly. And
It's all right.
sorry.
It's all right. Even if a little bit of cat sounds come, I think it's good.
So what I think was, जब भी आप किसी डॉक्टर के पास जाओ ना, just look around what he's doing. Just look around whether he is. Just look around. Am I audible?
You're audible. You're audible. Yes. Yeah. Go ahead. Go ahead. You're saying just see what the doctor is doing. Be observant. Like keep your eyes
Yeah,
open.
be a little observant. See whether or not the doctor. What most of the doctors are polite, and they will make you understand. They will tell you stuff like we will come to you, and they would most probably in their minds they will segregate you related to. Now there is somebody जिसका सर फूटा हुआ है, and then there are you जिसको उंगली में चोट लगी है. Yeah, then there are you who would who just have a small pain abdomen. So the doctor will see you as related to your urgency. So this is something which a lot of people don't understand. The VIP culture इतना ज़्यादा हो गया है हमारे देश में कि हम हॉस्पिटल गए हैं तो हम जरूर हमारा तो इलाज होना है, चाहे कुछ भी हो जाए. And the doctor should be there at our expense. ऐसा नहीं होता. Most of the time doctors are equipped at hundreds of stations at the same time. I'm there in the ward. I have to be responsible of the ward. I have to be responsible of the emergency. I'm taking samples at the same time. Imagine ये 3-4 स्टेशन से immediately कॉल आती है. जो सैम्पलिंग वाला बंदा है वो बोलता है कि नहीं हमें पहले करो, जो इमरजेंसी वाला बोलता है वो नहीं हमारा बच्चा इमरजेंसी है, जो वहाँ ओपीडी में आया होता है बोलता है हमारा बच्चा इमरजेंसी है. So nobody wants to understand, and sometimes because of there has been so much problems, there have been people really bashing it out on me कि अच्छा आपको हमारे बच्चा इमरजेंसी नहीं लगता. तो you know what, ऐसा नहीं होता है. You have to just be a little patient with your doctor. Sometimes वो भी 40-45-year-old are actually, so I'm what, I'm 26. मुझ पे ऐसे चिल्लाते हैं जैसे I'm their servant or something. And this is very rampant, this is very common. So have that little, that somebody even younger than me is a doctor and he's treating you efficiently or not, at least he's trying his best.
Right.
And just give him some patience, some time.
Right.
Which is
And
not there.
you've refrained from saying the word respect, and over and over you just say patience and time, and you want people to understand. But I think respect is also very important, Aheed. People should respect somebody who's studied for 5 years in a med school and done masters, and they've, I mean, thoda incentive. You have to think about these things as well. Like, I know, but patient ka soch sakte ho. You can imagine, they're there to get themselves fixed. They want to fix their loved ones, but you have to also understand that they're not trying to refuse you because they don't like you or something. It's not personal. They're doing it because of the constraints of the capacity.
Some people really don't understand this. कितना भी उनके सामने बीन बजा लो, वो ये चीज नहीं समझते. They have lived their lives in VIP culture, जहाँ पे वो जाते हैं, उनको लाइन से अलग जाके चीज मिल जाती है. If they go to a club, they pick out the line. If they go to a liquor store, they pick out the line. If they go to anywhere else, they pick out the line. So when they come to a hospital,
right,
they find this thing such an alien thing that अच्छा डॉक्टर ने हमें नहीं देखा, हम जैसे एंटर आए हमें गले में हाथ नहीं डाला. तो ऐसा डॉक्टर्स नहीं करते ऐसा. At least I don't do it. There are some doctors who still be like कि अच्छा नहीं है तो हमारा patient है, let's just treat him well. Good, treat him well, but don't treat the patient who really needs you not well. कोई आया है अपना सर फोड़ो आगे, who's unconscious, and then there is other patient who's your patient, who's your relative, and you are just talking to that patient. So ये मत करो. I have seen this happening as well. Go to the point is that this doesn't, जो random person है उसकी family तो खुद exactly डरी हुई है ना, वो तो तुम्हें कुछ नहीं बोलेगी. जो VIP patient आया है उसको तुम अच्छे से treat करोगे तो you will get all appreciation because of it. मैं ऐसा नहीं करता. I really triage people, and because of this I am in this constant problem के नहीं हमें क्यों नहीं देखा, हमें क्यों नहीं VIP तरीके से treat किया. And I don't really believe in that. I think if you are alone in the emergency room, I would 100% go and see you. I would be polite to you. I would be helpful to you. But if there's somebody else who is really in need, who is sick, then I would see him first. I think this is the basic of medicine, and ये चीज हमारे देश में लोग नहीं समझते. हमारे देश में क्या, बाहर भी नहीं समझते. बाहर भी they even in US they think that okay, we are there. Now we have entered the hospital, we need help immediately. We should be the center of attention.
Right. Aheed, I want to ask you a little hypothetical question. One of the last few questions that I want to ask you. If you were the health minister of India tomorrow, what would, see, I know it's a little hypothetical, but just wear the shoes of the health minister. So Dr. Aheed is the health minister of India. Where would you want the resources to go?
I think I would still
especially
say
in
that
this pandemic situation, like now that a pandemic has happened and something like this can happen in the future.
See, the first and the foremost would be the severely affected patients and their tracing. This is very important. जो भी severely affected है, जो patient है, are they getting the care and are they getting tested right? That should be the first most concern. The second concern would be, are healthcare workers feeling safe enough? Are they getting enough protection? Are they getting enough PPE? Are they not being ostracized? I think health ministry have so far done all these things, but now comes to testing. Testing is एक ऐसा area है ना जहाँ पे as a developing nation we can't really do a lot of testing. One, because there is not a lot of test kits involved. We have 100 people who need the test, and we have 100 people who want the test. तो मैं वांट पे नहीं जाऊंगा, मैं जो नीड पे है उनको जाऊंगा। मैं हॉटस्पॉट से लोगों को निकालूंगा और मैं देखूंगा कि इन लोगों को तो नहीं है, because I will use the test kits on them. I would not, go to a posh colony in Basant Kunj and I would tell the elites कि नहीं नहीं आप 100 लोगों तो आप 100 टेस्ट करा, and I would waste this. I would not do that. Irrespective of these 100 people having the representation in the media, having these influence on people, and they'll be telling everybody else कि अरे इंडिया तो टेस्ट नहीं करना. But no, I would still be testing the 100 those who really need the test. तो ये जो डिबेट है ना on whether India is testing, although India has tested 1 million plus, which is a lot, which is a good rate, but sometimes there are still people saying कि 130 crores में आप इतना कम टेस्ट कर रहे हो. Bullshit, we are testing those who really need it.
Right. People who have symptoms.
Who has symptoms, who has contact, who has a positive history. There is an entire list. All doctors who are getting symptoms, all positive contacts who are getting symptoms. So जिनको जरूरत है उनको तो टेस्ट करो यार. जिनको नहीं जरूरत है, जो घर पे बैठे हुए डर रहे हैं कि नहीं हमें हो गया होगा, हम टेस्ट करा लेते हैं, तो नहीं ना, उन पे टेस्ट क्यों अभी वेस्ट करना है.
Right.
अभी नहीं करना टेस्ट, किस उन पे वेस्ट. तो इसलिए आई थिंक टेस्टिंग, अगर हमारे पास और टेस्ट किट्स होते तो हम शायद और टेस्ट करते. Also, I have seen that a lot of patients, since they are asymptomatic, they have been subjected to discrimination. And मान लो मैं asymptomatic हूँ, right? I don't have any symptoms. I get a test done. Now I'm positive. Everybody around me would panic. So I think this is something of an unofficial thing which the ministry is also planning. कि symptomatic ही कर रहे हैं, asymptomatic लोगों को टेस्ट नहीं कर रहे हैं. I am pretty sure that a lot of people still have more of this viral load, but they are still asymptomatic. Their bodies are, fighting off the disease, but they don't matter right now. Those who matter are who are at a serious life threat. So, उनको जरूरत. So I think that's ideally it should be everybody tested. But in an ideal world, this virus would also not be there. So
right.
We're dealing with what we could.
That's true. Man, Aheed, this has been a very, very interesting conversation, man. We could go all night, but I'd like to conclude this now. I think it was really, you touched upon a lot of topics. Is there anything you'd want to add? Like, is there anything you think you'd want to say to the people who are feeling anxiety, or they, just be cooped up in their house? It's a weird situation for all of us, and especially for you, man. मैं आपसे एक हफ्ते से बात कर रहा हूँ, and every time I talk to you, you're like, I'm in the emergency room, I'm in the hospital. You're out and you're working, so you're facing the real anxiety. But there are also people who are getting so much information from the news. Like I know, like my own grandparents, they're sitting in front of, they won't be listening to this, but just as a conversational thing, when they're sitting in front of the news, is there anything as a doctor you'd want to say to the people that can, anything optimistic? I don't want to, because we have really touched upon some issues, but like there can also be something that, some positivity that we can look towards the future, something nice.
Well, first of all, we will get through this. It would be a little different world than we were used to, but slowly life will come back on track. The only thing is that, so I always say that, sometimes bad times do linger on for a longer time, but it eventually gets away, with a good time. And the only thing that you have to learn through this is that, first of all, control your anxiety a little bit. We need to give our anxiety gradings. So, लोगों को क्या होता है, hospital में patients आते हैं, with a complete full-blown panic attack. Just grade your anxiety. You know what? Take a list and just write the 10 points which really trigger you in an increasing order of severity. कि आज मैंने ये news देखी, इससे मुझे trigger हुआ 1. सेकेंड पॉइंट मैंने आज ये किया, इससे मुझे और ट्रिगर हुआ, एंड देन इन फ्रंट ऑफ इट जस्ट राइट कि अच्छा मैं ये करता हूँ तो मुझे अच्छा लगता है, मैं ये करता हूँ तो मुझे ये अच्छा लगता है, मैंने पॉडकास्ट किया तो आई फील गुड, आज मैंने बाहर वॉक के लिए गया तो आई फील गुड, आई वॉच दिस सीरीज सो आई फील गुड, कीप राइटिंग दैट. So grade your anxiety on a scale of 0 to 10. Right. Grade your anxiety कि कितना आपको अभी इस लेवल पे अपने किसी स्टैंडर्ड के हिसाब से anxiety हो रही है. 5, 6, 7 से ज्यादा हो रही है ना. So talk to your friends, talk to people, watch mental health. I have actually done a podcast on mental health which I would be publishing soon. So go and see those podcasts, see people talking positively about all this. Har time
Right.
news mat dekho. Go watch dog videos or cat videos or whatever that really helps you reduce your stress.
Right.
And breathing is very important. Secondly, there are a few exercises that you can do. I can't really explain all of them. I think I have a friend who is a psychotherapist, and she has explained to me that there are some breathing exercises, and there is also this brace position where I don't even remember how she did it. So you need to keep your right arm under your this, and the second arm, this arm on your heart here, right arm on your heart, and the second arm here. So it basically creates a brace position.
Right.
This thing would be here.
It's like heart. Hugging yourself.
The other arm, it's like hugging yourself.
Right.
And keep that in a position like this. Your right hand should be on your heart. It should be in your heart.
Right.
Heart, Naman. Heart.
0 marks for anatomy, Naman. Yeah, I get it. Yeah.
So it just, and hold your tie and tell yourself that you'll be okay. And it's something that most of the people who are living alone, or even if you can't share with somebody, you can do that. And there are other exercises. Follow up a routine and watch cooking shows. People like cooking shows. Really help people. I don't know how, but it does. It really.
Food is like that.
You get so many ideas. I know. Maybe you will feel hungry more.
Right.
Maybe you will start gaining a bit, but that's okay. You will be getting distracted. There are so many good shows. I don't know. People just keep watching all these Khoon Kharaba on Netflix and Amazon Prime. Just go watch a travel video. Go watch a cooking video. People make such beautiful food, such beautiful places they go, and it's really nice. It helps me settle down my anxiety.
Right.
I'm sure if not 10, it would help 1 at least.
Dude, just last night I was watching The Shining. It's a horror movie. And I have to say, dude, that was a very stupid decision because...
Not a good time to watch it.
I know, right? Not a good time. Don't watch The Shining. Watch something nice. Watch as you say, like a food video or a travel video, or something related to mental health. And it's such a new time where we have so much time with ourselves. We can either be constructive with our time, or we
watch all the classics. I would say if somebody is really into movies, right? Watch all the classics. Start watching Star Wars. Start watching Lord of the Rings.
Right.
Start watching Indiana Jones.
Like Martin Scorsese movies. Taxi Driver. I watched the Taxi Driver recently, and I watched Shawshank Redemption. All these movies, people talk about, but you somehow miss them.
And so if you so I'm quite much into animation. So
nice.
मैं वो सब पुरानी 80s 70s की old animation Disney movies आजकल देख रहा हूँ. And sometimes the story is really nice. So it helps down. It helps down. Really does. I also write. So मैं आजकल लिख नहीं रहा क्योंकि my mind, when I write, I usually go out. I sit in a coffee shop and I write, or I do something like in a park or I write.
Right.
घर पे बैठ के इतनी writing होती नहीं है. But it's but yeah, I like to write. And if you do want to write,
you'd mentioned that you've authored books. Tell the listeners about your books. Like, what have you written? Where can they find it?
So last year I published my 5th book, which is called Bleed, and it's an anthology of 50 poems.
What is it called again? Can you repeat the name of the book?
Into Bleed. B-L-E-E-D.
Bleed. All right.
Bleed. Blood. Bleed.
Right.
So it's about so it's basically like a relationship. It starts with a good time, then it has 5 poems in it, then there's other anger, and it has 6 points which with different poems depicting that particular emotion. And उससे पहले there were some memoirs and short stories. I keep writing short stories for my blog, and it's something that I share now and then. But it helps me. It really does help. It helps me to calm down, and it helps me to. It just it's really therapeutic for me.
That's amazing, man. You're such an amazing personality because writing a book, like reading a book makes you a man, but like writing a book makes you a little more than that, because like it takes patience, it takes a lot of dedication, and it takes creativity. It takes so many things. It's like you say it's therapeutic, but a lot of people try and write books, but they never end up doing it. But I think, what is the feeling like when you finish a book? What is it like?
It's a good feeling, no kidding. But you know what? The first of all, when I started writing these poems, right, it was not for anybody else. I never even published these poems anywhere. So I remember last to last year, before my brother, when he got married, I thought, okay, let's compile these poems. It's important because ये सब पड़ी हुई हैं वहाँ पे, धीरे-धीरे खो भी रही थी, मैं कभी इधर लिख दिया, कभी उधर लिख दिया. So what my thing was that sometimes I used to go some really stressful days in the hospital, or even as a medical student, or sometimes other issues. And I write something, and it's like, that Dumbledore had that pensive, right? So it just goes off your mind and into that thing.
Right.
And it just stays there. So there are poems which completely capture the entire emotion of my day in one paragraph. And I don't really go and read that, because when I want to relive that part in my life, so I also write a lot of angry poems, and I don't read them because they make me angry. So in Bleed, there's a section called anger, and I don't read those poems a lot. So it's like it's really helpful. It has come out of my mind and into somewhere else. It doesn't keep, it's like what Dumbledore says, like, it's better to be out than in. So that's important. And as you said, writing a book, write it for yourself. Write as if you were reading it. Don't write it to make it sensational.
Right.
Most of the books that you would write, उसमें से तुम अगर 10 लिखोगे तो उसमें से एक sensationalize हो जाएगी. But every book will help you as a person to grow. Every book will help you, even though anybody else would say कितनी भी crappy book तुमने लिखी है, for you it should mean your mental space is good and you are having a therapeutic space because of it. And that is the feeling to go for, rather than the feeling to complete a book. Now उसके आगे I'm also writing like a fiction fantasy. So अब देखो क्या होता है, अभी टाइम नहीं मिल रहा है, काफी साल से लिख रहा हूँ.
Yeah, the contrary part is that the contradiction is that a lot of people have so much time, but you don't have much time because you are working on overdrive right now, because you're our frontline.
Right now, yes, of course, but I do write sometimes.
Nice, man. Nice. I really wish you the best with your writing. I really wish you, and I want to thank you, man, Aheed, like from my side and for whoever's listening this.
Thank you so much, Naman, for being so patient. I was just constantly, delaying it, and I thought, nahi, ab to kar hi lete hain.
No, it's all right, man. Whenever it happens, at the best time. And I'm glad we did this. It was great talking to you, man. And I hope we do this offline sometime. Like we'll do another podcast together, man. Like once the world is better, in a better situation.
So I saw that you do a lot of, interactive podcast.
Right.
And I would love to do that soon.
100%, man. I like to talk to people, talk to interesting people like you. So it's great. Thank you for taking out the time, Aheed, Dr. Aheed. I want to say this, doctor, because, I give you respect, man. I feel it like after having this conversation with you. So thank you so much for your time. And this was great.
Same here, Naman. Glad to be back again. Also, I want to know about that mic. Is it an ASMR mic?
Actually, no. It's what do you mean? ASMR, is that like the pleasurable thing you're saying?
No, the highly sensitive one.
No. This is
I'm thinking to get one.
It's a Blue Yeti.
This looks nice.
It's a Blue Yeti. Yeah. Get this mic, man. It's a really nice mic. Blue Yeti condenser.
You just connect it to the laptop and it works like that.
Yes, you just plug it into the laptop. Yeah, and it takes the input. It's a nice portable microphone, and yeah, you can get it on Amazon. It's a good investment.
Amazon. Abhi to I ordered so many stuff from Amazon and they just got delayed.
They're not gonna deliver anything, man. Not right now. Are they delivering? Like you said, you ordered stuff. So did they get anything for you?
I ordered something, but it just got delayed. It was like they don't want to deliver anything.
God damn. Yeah. But dude, man, this is amazing. So we'll wrap this up now, Aheed.
Sure.
Yeah. All right. Peace out, man. Thank you so much for doing this, Aheed. Nice to have you. It's the end of the NancoVerse podcast with Dr. Aheed. Cheers.
Glad to be here. So good.